respected all the dignities on the desk. In front of you, I am Ananya from B Form first year. Today I am here to explain a topic on kill cancer. So let me tell you a few things like what is cancer and types of classifications of cancer and significance, symptoms, treatment, diagnosis and prevention. So firstly I want to say that cancer is a genetic disorder which involves the rapid cell division. The cells create the clusters. A cluster is nothing but the tumor. That clusters may be cancerous or non-cancerous. So cancerous, the major difference between the cancerous and non-cancerous cells is like the genes send the instructions to the cancerous and non-cancerous cells, whereas cancerous cells will ignore the signals from the genes, but normal cells will receive the signals from the cells. So mostly and according to analysis, 1 in 4 people are getting infected due to cancer once in their lifetime. So most of the people are dying during cancer. So let me tell you the classifications of the cancer. There are 100 types of cancers are recognized till today, but based on the board classifications, there are 3 types of classifications that are, first one is solid classification, blood cancers and the mixed ones. First one is blood cancer. So these blood cancers, as the name itself says, that this involves the involvement of bloodstream and the lymphatic system. So this in this classification we can see the types of cancers like leukemia, lymphoma and melanoma. Leukemia is the cancer which destroys the RBC site, that is nothing but the bone marrow. And next one is lymphoma. As the name itself says that this affects the lymphatic system. And the melanoma, this affects the plasma. And coming to the solid ones, these are the common cause of the cancer, common type of cancers that includes about 80 to 90% of the cases. So we can see the cancers like carcinoma and sarcoma in these types. So carcinoma is the type of cancer which affects the epithelial tissues. We can see the types of cancers like breast cancer, colon cancer, oral cancer and lung cancers. And whereas coming to the sarcoma is the type of cancer that infects the bone and the connective tissue. And coming to the third one, mixed ones, is this includes the subtypes, that is carcinosarcoma and adenosquamous carcinoma. And there are the symptoms which can be indicated as we are infected through the cancer. So the symptoms may vary from person to person, depends on the type of the cancer. So firstly, the general symptoms of the cancer are fatigue. We can feel giddiness or we can feel fatigue and abnormal weight loss, abnormal weight loss and bleed in stools and cough and bleed and etc. And coming to the risk factors, there are many risk factors which can lead to the cancer. So firstly, I want to say just some risk factors that majorly affects the cancer. So first one is the family history. Those who have the family history, they may get a right risk of hepatic cancer. And next one is the exposure to toxins. Exposure to toxins like pesticides, radon, and some of the toxins may cause high risk of getting cancer. And radiations. As we all know that radiations are the very harmful that may kill our cells. So where do we get radiations? From UV rays. As we all know that ultraviolet rays are very harmful, right? So these radiations will lead to the formation of cancer in our cells. There is we have to detect this cancer in early stages to prevent our life. So, there are some methods like blood tests, CTC, and tumor makers, and imaging tests like CT scan, MRI, and biopsies. And so, let us know the stages of cancer. Generally, there are 4 stages of cancer. In first 3 stages, stage 1, 2, and 3, we can prevent the cancer by giving suitable precautions and therapies. So, in this first 3 stages, there are no spreading through the lymphatic system. So, whereas coming to the fourth stage, these may lead to the spread throughout the body by mixing like in bloodstream and the lymphatic system and treatment of the cancer. So generally I want to say just 5 treatments, that is surgery that comes under the targeted therapy, and chemotherapy, immunotherapy, radiation therapy, and the bone marrow transplantation. Thank you.